Okay. Good morning and a good day. Have a smiling day, all of you. When we're talking of pemphigus, usually we think of Pemphigus vulgaris. Doesn't mean she's a vulgar pemphigus. It's a common pemphigus. It's not a disease of today. It has been disease for centuries. Even today, if any patient comes with some bullous lesions, the chronic teachers, the seasoned teachers will ask him, check Pemphigus vulgaris or not. It means a type of disease activity situation in which vesiculobullous come across human body and they are denuded always. They may be present on any part of the body, including the mouth, genital areas, and the various parts of the body as well. When you see this, you feel very bad because you may not be knowing the treatment. You know the treatment, you want to be sure what it is. You may take a biopsy. When you take a biopsy, it is intraepidermal acantholysis. The epidermis is broken at certain places. If the epidermis is broken as near the top, it may be Pemphigus foliaceus. If the epidermis is broken in the mid, yes, it is Pemphigus vulgaris. Then some people may like to do certain investigations related to electron microscopy, related to various techniques. And then there's another question. What treatment we should offer to this patient? You may read certain CME articles in various books or journals, and then you are confused what to do. Should you give steroids a lot? Side effects are there. You give cyclophosphamide a lot, side effects are there. Do you need a combination of drugs? You don't know. Then you want to know the drugs which the patient is taking, and then you want to stop them as well. And when you try to think of treatment, you have to think a combination treatment. Some people have published their articles in journals, like in International Journal of Rheumatology, in which they mention which drug they have been giving for a certain period of time and then stopping it for a certain period of time. And they're giving some antimycotic drugs for a certain period of time. And they want to see the response and then to avoid side effects. At the same time, they want to avoid and stop unnecessary medication being given to the patient. His diet is managed, he is told to walk a lot, and if the walking is up to comfort of him. Good food, nutritious food, food of different type, and he is encouraged to meet his family members as well. And he is encouraged about the disease patterns. When the disease tablet is given, you may be giving oral treatment of steroids, you may be stopping it, and you may be giving anti-cancer drugs like cyclophosphamide and drugs, and they are giving in a regimen. You have to keep the treatment protocol in certain special papers, one copy for the patient, one copy for yourself. Once you're discharging a patient without any side effects, you have to give him a treatment sheet. Tell the patient if you need more treatment options or any help, come to us directly here in the ward and we will help you out. And then this is the way you continue with the patient, and then if you have to give some drugs based on some side effects internally or externally, his consultation has been taken from the other department, reassured, and should be given treatment accordingly. And then we have to avoid drug-induced situations. The patient may be taking some unnecessary drugs, unfortunately, so you have to avoid those situations as well. If you have some fungus in certain part of the body, superficial fungus, you have to give itraconazole or something. The patient is okay. And reassure the patient he should come to weekly or after 2 weeks, and then should be taken care of. Tell him to avoid other clothes except cotton clothes, use the moisturizer soap, and then be happy. If you need some off from the treatment, he should be given. Happiness is one of the treatment modules. He should not run in hot weather. He should be cool in combat area at the night as well. His family should be reassured what is going on. This is a way to manage it. Although some other pemphigus may be seen in other parts of the body as well, but this pemphigus virus is the bad person in this group. Why? It can go to a bad situation, very bad situation, in which you said we have some bad news. Maybe to a good situation you have some good news. And that when it is good news, you have to take care that things are going fine and smoothly, the patient is taken care of. And if it's a bad situation, you should be admitted to the hospital in ICU ward or in other situations, and is given proper treatment, a certain maximum and drug, and then should be taken care of from head to toe. This is the simplest possible way to talk about this drug. And then, as the vesiculobullous diseases, we have to know about the immunological status of the patient, but the drug of the patient, or the health of the patient, and his medication which he is taking as well. So keeping all things in mind, he should be seen regularly, especially in the ward, and taken care of nicely. I wish best of luck to all the patients from suffering this type of vesiculobullous disease.